Okay, a very good evening to all of you. Namaste to all the
Mm.
seniors. And thank you. It's been a while having seen all of you. So, welcome, welcome, welcome. Today, your beloved Money is not here. As you all know, she's in traveling currently. She's in India. But yes,
Sorry,
I'm here.
what
My name
happened?
is,
Thanks, man.
if I can
Company
request
message.
rest of them to stay muted. That will be helpful so the conversation is not disturbed. Yes, thank you. So my name is Vaidehi Raut. I'm the chairperson of Panorama India, and we conduct these senior sessions to educate our seniors with topics which will benefit them, which help them, and which would be good for their health and wellness. So, of course, today actually we have a topic about physiotherapy. I'm sure we all go through different kinds of pains and aches and some kind of ailments which we have to treat. Not only you, just me as well, So, I think this information is going to be very helpful to all of us. So, today we have a wonderful host, a young lady. Her introduction is definitely very important. So I want to welcome Miss Kritika Ravi. So
Namaste, everyone. Yeah.
namaste. And we are pleased to introduce Kritika Ravi, who is a dedicated and compassionate registered physiotherapist in Ontario, who is truly passionate about helping people feel their best. So, with over 10 years of clinical experience, Kritika has worked in a variety of settings, including hospitals, orthopedic clinics, and long term care in India and Canada. She completed her Bachelor of Physiotherapy in India, along with advanced training in orthopedic and sports rehabilitation, bringing a well rounded and thoughtful approach to her care. Kritika is known for her warm and caring nature and for taking the time to really understand each person she works with. She has experience supporting individuals of all ages, from children to older adults, with a wide range of conditions, including injuries, surgeries, chronic pain, musculoskeletal, neurological, cardiopulmonary, and sports related issues as well. She believes that healing is a journey and takes pride in building meaningful connections with her patients while guiding them towards their goals in a supportive and personalized way. So, outside her professional life, Kritika enjoys spending time with her family and friends, traveling, singing, and exploring her creative side through arts and crafts. So, ladies and gentlemen, meet Kritika Ravi, registered physiotherapist with 10 years of experience providing compassionate, holistic care for all ages, helping you move better and feel your best. So, without further ado, I would like to hand over to Kritika. She can say a few words and begin there. If I may request all of you to stay muted, let the complete presentation finish, and we will definitely have time for question and answers after that. So Kritika will be happy to answer your questions if that you may have. And of course, such as a pleasant face, like I'm sure, looking at her itself, a lot of pains will get healed. So over to you, Kritika. Welcome. Take it from
Thank you
here.
so much, Vedehi ma'am. I am very happy. First of all, namaste to everyone. Good evening. And thank you for taking out some time for this wonderful session. Hope I can just make you all stay glued to the presentation and the session today. And the last few minutes, we'll have a question and answer session so that all of you are free to ask any questions or share any doubts or concerns about what we discuss in the session today. So I think it's a good time to start. Yeah. So I'll start sharing my screen. Can everybody see the screen now? Yeah.
Yes, we can
So,
see.
yeah. Welcome, everyone. Firstly, I'd like to introduce myself. My name is Kritika Ravi, and I'm a registered physiotherapist here in Canada. As Vaidehi ma'am already gave a brief introduction on me, so like I'll be your host for today. I would first of all like to thank all the wonderful members, like particularly Vaidehi ma'am and Mani ma'am, for giving me this opportunity to connect with you all today. And let me share some brief but useful insights that can help enhance your well-being. I always believe that physiotherapy as a profession, it's more than just pain management. Nowadays, like we all are in our stressful lives, so engrossed with the daily routines and lifestyle that we sometimes fail to acknowledge our body and respect like what is going on with our body. So physical therapy not only just adds life to the days, but it is more than just taking medicines or undergoing the surgery. So today's session will move on, and basically the agenda and purpose of today's online session is to promote education and awareness. The senior wellness session today will help you understand how you can move better and live a pain-free life, and maybe going forward, um, give a brief introduction on some basic day-to-day exercises. And if you have any doubts in the end, we'll be loving to hold and help you like go through the journey. So let us begin. The key highlights for today's session, mainly we'll be discussing about how physiotherapy and massage therapy can be helpful for the seniors. And a very important thing that mainly I come across is how to approach the therapists. Like we all like know what to do, but sometimes we don't know when to do and what to do or when to start. So we will also talk about briefly about the insurance coverages and how you can approach and avail those services of physio and massage therapy. It is also important to note the importance of mobility, important of flexibility and safe movements in your day-to-day life. Also, I'll be discussing a few things about how to prevent pains for a longer term, how to prevent and deal with the stiffness that we usually have in our day-to-day lives, and prevention of common injuries that many of you would be commonly coming across. And a very important topic that I always stress upon, particularly when um, dealing with seniors, is about the prevention of injuries and falls connected with the injuries. So whenever like we are discussing about the falls, we will talk about some tips and strategies and useful exercises that can help overcome those barriers. So my motto would be to stay active, to stay healthy, and to stay independent. So these are the key highlights. Hope everybody can still follow on the slides that I'm presenting on the screen. Maybe Vedahi ma'am can just give a heads up on that.
Yes, all good. Yeah, yeah.
You're still on the right page, right? Okay.
Thanks.
Okay. So next, moving on. Very importantly, a lot of us we know about what physiotherapy is, what massage therapy is, but there is also sometimes a lot of confusion between the two terms. Like basically, like we get confused between what the physiotherapists do and what the massage therapists do. Both of them, they are two very different professions, and both of the therapists are experts in their own fields. So most of us know that like physiotherapy is basically using some kind of physical modalities, either through touch, some physical movements, or machines to restore and maintain function. Basically, loss of function and loss of movement is what the physiotherapist deals with. It is also important to know that physiotherapy is not just pain management for a specific injury. Sometimes we wait for our body to start giving alarm signs, or we wait for it to get injured to actually go and see a specialist for that. But at its core, physiotherapy not only helps individuals affected by those injuries or illnesses, but also to a large extent to maintain the body moving in a normal manner. So be it a disability or a non disability, through personalized care plans, physiotherapists can make you feel better. It is not only addressing the source of discomfort, but also improves or maintains the overall quality of life. Basically, a lot of problems come with aging. So, why not age gracefully when you can? So, through prevention, rehabilitation, and wellness promotion, whether you're recovering from an injury or managing chronic pain, or just simply trying to move better. Physiotherapy can be the key to regaining those strength, mobility, and other issues that you might be facing, or even if not, just providing you with overall well being in day to day life. When sedentary lifestyle and in this age a lot of postural stresses and injuries are commonly increasing, then physiotherapy offers not just temporary relief but a holistic approach to healing and long term health benefits, and thus improves the overall quality of life both physically and mentally. Now, usually a lot of patients think that physiotherapy is just treating arthritis or just treating pains like sciatica or just pain management. I would like to enlighten what physiotherapy conditions or what a physiotherapist basically deals with in day-to-day lives, particularly in multidisciplinary practice settings. Like you might have come across clinics, like almost every plaza that we have here in GTA would be having a physiotherapy clinic. But sometimes we just think that, okay, no, why should we go there when we don't have a pain? Physiotherapy not only covers a wide spectrum of medical issues, but it also helps with overall rehabilitation and well being. It caters to almost every age group. Today, I'm being given an opportunity to address an age group which I personally really like working with. Maybe because it's like the way that we have been brought up and the exposure that I usually got coming from culturally rich background, like working with seniors. But there are a lot of other conditions that physiotherapists can actually help you with. This information will not only help you as participants, but maybe like once the session is over, you will have a handful of information that you can pass on to your friends, relatives, anywhere across the world. So what physiotherapy conditions include would be musculoskeletal conditions. Now, these mainly involve muscles, as the name suggests, and the skeletal system of the body, including the bones and small soft tissues like the ligaments, the tendons, or anything that supports or help us move in day to day life. Conditions that you commonly across would include fractures, arthritis, muscle pains, simple muscle pulls or aches, tears, sciatica, and so on. Neurological conditions. Now, one must think that why neurological conditions? What a physiotherapist can do. But anything that concerns with a joint, muscle, or a nerve, a physiotherapist can help you fix those issues. Lot of times there are long-term conditions like stroke, Parkinson's, multiple sclerosis, even sometimes traumatic brain injuries or spinal cord injuries and surgeries, after which the doctor would definitely say that, okay, you require to go a complete physiotherapy rehabilitation. Cardiopulmonary conditions, very interesting. Be it a condition of the heart or lung, directly a physiotherapist might not be able to fix them, but definitely there are a lot of surgeries or lot of conditions after which you need to get going. You need to get up, stand up, and continue with your pre surgical lifestyle. And that is when a post surgical rehabilitation is usually recommended by the physician, by the hospitals, and even the physiotherapist. A lot of conditions concerning the pediatric and the geriatric age group. Pediatric conditions like a lot of kids having developmental delays, cerebral palsies, milestone delays, they are also well supported through physiotherapy rehabilitation. Older adults, right when the body starts stops growing, that is when the aging starts. So even at my age there are a lot of age related changes that already start happening, and nobody is getting any younger, so definitely we all need some kind of help down the line to deal with these conditions. Commonly, arthritis is one of the favorite conditions that usually the body would come across, and sometimes there is no way to escape those conditions. But how you deal with these conditions and how you manage them is more important. Another important condition that usually comes in the senior population is the osteoporosis. Even taking vitamin D's or calciums or multivitamins sometimes won't help, because osteoporosis can be a systemic condition that goes much more beyond just being deficiencies. So, how to prevent or manage those age related conditions, and because of that, maybe prevent injuries like falls, is something very interesting that we would go further and discuss. Sports injury is one of my favorite topics, and I believe me, I have a lot of senior patients who, even in their 60s, 70s, 80s, are very healthy and still continue to play the sports what they like. Not maybe for a competition or an elite level performance, but just for their own passion or leisure. So, athletes recovering from simple injuries or complicated injuries like surgeries, ligament tears, muscle strains, sprains, rely on physiotherapy for faster and safer return to performance. Now, once we discuss about all these conditions, like what is physiotherapy, why, and what conditions are treated with physiotherapy, it is important to know what techniques we employ as physiotherapists, so that when I talk about massage therapy, there will be a better understanding how the two professions are different from each other, and how it is also different from other professionals like chiropractic services, osteopathy, and so on. Very important techniques that we usually use is something called hands on manual therapy techniques, where we use our hands to work on the patients. That's why it is very important that maybe when you go to see a physiotherapist, they will always ask for consent before they can work one on one with you. Joint manipulations to improve your joint mobility and flexibility, soft tissue massages or trigger point releases or facial releases to basically reduce the muscle tension. Very favorite of many people, the cupping, the dry needling, also kinesio or athletic taping. All these conditions are usually like very commonly used by most of the physiotherapists. Very important is when a patient comes with an acute injury, right away your physiotherapist cannot like start mobilizing you. There are certain electrotherapy techniques, or what we call in a layman or common man's term as machines or modalities, where we use physical forms of energy like electrical currents or ultrasound or light to help you get better with the pain first, and then start with the mobilizations and exercises going down the line. Very common and day-to-day modalities that usually physiotherapists would use would be, you might have heard of a lot of these, like the TENS, the laser, the ultrasound, the infrared therapy, heat and cold therapies that are used to help relax the muscles and joints, reduce the inflammation, reduce the swelling, and then going ahead with the exercises. Exercises are basically tailored. It is not like every patient or every person is given the same set of exercises. It is customized to strengthen the muscles and improve your range of motion. And that is the key to the physiotherapy, exercising. Also, through exercises that are aimed at restoring the balance and coordination, that helps with walking, postural correction, sports specific injuries. We help the patient through the journey of healing. And most importantly, your physiotherapist will always sit and spend some time to talk to you, to walk you through the process, educate you, and advise you on how important the correction of posture is, how important the ergonomics is, how important your day to day lifestyle and self care routine is, and how you can do certain strategies like do's and don'ts or preventative strategies that help prevent re injuries and recurrences of those injuries. Next, we move on with how physiotherapy can be helpful. Till now, we have been talking about what or how we treat the patients when they come for physiotherapy. Very importantly, it is important to know that physiotherapy is not just relief of pain, but it also helps with improved mobility, like improving your joint range of motion, improved flexibility through stretching and strengthening exercises, prevention of injuries, like I was talking about in the previous slide, how certain muscle weaknesses and imbalances, if not corrected with exercises, can cause recurrence of injuries, and maybe in the longer run, it would just not help you with feeling better. You might go and take a few sessions of therapy, like physio or massage, and then feel good for a certain number of days and come back with same injury or maybe even worse. So it is very important to know those strategies for injury prevention that can be only attained through exercises. So even when the symptom of pain is gone, it is very important to work on your muscle weakness and strength and to attain improved flexibility so that these conditions do not or are not prevalent for a long term. Faster um, a lot of patients also come to us after surgeries or even sometimes before surgeries. Like you have a date for a surgery, like a shoulder replacement or a knee replacement, or maybe there are certain other smaller or bigger injuries. So, faster recovery with physiotherapy can be attained post surgery or even accidents if you properly follow a set rehabilitation. The physiotherapist will be guiding you week wise or even day wise sometimes what to do and what goals to be achieved. A lot of times with these muscle weaknesses and injuries, your balance and coordination gets affected. So for individuals affected with those conditions, physiotherapist can help you attain those balance and coordination. And sometimes it is not just musculoskeletal conditions, but neurological conditions or age related conditions as well that can affect your overall posture and balance. And therefore, this physiotherapy can help the reduction of the risk of falls. And therefore, it not only helps to build confidence in the patients, but also like everyday individual movements, they can gain more independence with that. Very importantly, sometimes we come across very chronic conditions like arthritis, which starts at a very early age and manifests itself in the long run. So, management of those chronic conditions like arthritis, fibromyalgia, not only helps the patients manage the symptoms, but also maintains mobility and independence, and therefore helps to have a control of their lives. Next, I hope everybody is like following me and trying to get a hold of like what we are discussing. A very important topic, like for most of us, next is massage therapy. I know most of us look forward to massages, right? And it is definitely a very good idea to take regular massages time to time. Massage therapy is a hands on technique where the therapist, a licensed professional called the registered massage therapist, would be working on the soft tissues in the body. And this would include not just the muscles, but also your soft tissues supporting the joints, like the tendons, ligaments, etc. They basically apply pressure as per your tolerance, and there are various strokes or techniques like kneading, rubbing, tapping, sometimes to various portions of the body to promote physical and mental relaxation and well-being. I understand, like in today's fast-paced world, it has become more popular than ever. And sometimes patient would come to me and ask, like, why not massage? It is important to understand when you need to go to a massage therapist and when you need to see a physiotherapist. So if you are having an acute pain or an injury, it is always better to see a specialist who can help recover from that, and then the massage therapist, so that you have a more long term maintenance and a feeling good factor after that. Massage therapy again has numerous health benefits beyond just relaxation. So sometimes a lot of professionals, a lot of individuals like seniors, even kids, sports specialists, they would take a massage therapist. Like for example, they know they are going to have a heavy workout or they are going to travel somewhere, so they take a physiotherapy session or a massage therapy session and then continue with those activities that helps them feel eased after that intense workout session. So guys, like everybody like would be looking forward to have a massage therapy session soon after, I think, understanding a bit more about massage therapy. So this is just a fun slide. I know massage therapy basically can hardly have any side effects, but of course the good side effects would include the following. Stress reduction, very important to feel relaxed, right? In today's day to day life, when all of us are so stressed with physical and other mental stressors, it's very important that we know the benefits of massage. It not just improves mood, but also to a lot extent helps improve the immune system, the body blood circulation. It also enhances better sleep because of the release of those chemicals in the body, the feel good hormones and chemicals. It definitely helps us sleep better. So a lot of times, if any of you have taken a physio or a massage session, sometimes they do complain that okay, we slept a lot, but it's a good effect, it's a benefit of the massage or the physio session that they took, because the muscles, they get so relaxed after taking a session that you would feel that okay, now the body reacts in such a way. Very important. Similar to a physiotherapy, massage therapy can help or do wonders with pain management because it can help reduce the muscle tension. Therefore, after injuries or chronic conditions, including arthritis, even sciatica, massage therapy can help to a lot of extent in getting better with the pain and stiffness. Blood circulation definitely gets reduced because of those strokes, and definitely there is more nourishment and oxygen to your body tissues that not just helps you make feel good but also recover from any injury. Lot of massage therapists can help with swelling. Lot of specialized therapists are there who definitely work with patients after surgeries and after even conditions like cancers where a lot of fluid can get accumulated in different parts of the body. Therefore it promotes healing. Lot of physiotherapists, and lot of times I personally work hand in hand with massage therapists and inter-refer my patients to massage once their condition is scientifically better. So definitely it would help enhance the flexibility, the range of motion, and definitely makes them feel ready to do the exercises. And therefore a lot of athletes, a lot of patients having chronic pains and other conditions turn to massage therapy to improve their performance and thus prevent injuries. We are not going to go in detail with the types of massage therapy today because I'm not the specialist in massages, but definitely this is something that can give a brief idea of what to expect when you go to see a massage therapist. Similar to a physiotherapist, a massage therapist would also provide a detailed assessment, and they would help you understand the condition first and then indicate what kind of massage would suit you best. So every type of massage has its own benefits and own different techniques. So once you feel ready, you can always go and see the therapist and get to know which one is the best for you. Now, once we have finished talking about what these therapies are, two important therapies that people usually go and take, it's important to know when is the right time to see your therapist. Believe me, there is no perfect time. So you have to make use of the time that you have and make it perfect. Because sometimes just waiting can make you lose that time, and then before it's too late, you don't know what to do, and then try all desperate measures. Instead, right when your body starts giving you alarm signs, you should respect that and seek consultation for that. Again, I repeat that you do not need to see a therapist only when you have an injury or pain. You can always come and see the therapist for prevention of that injury and pain too. So do not wait for your body to start giving you alarm signs. If your body has already started giving you alarm signs, then please do not ignore them. And when you know that, okay, there is something wrong, go and seek help. Do not delay to start the treatment. Without a timely or proper treatment, your recovery can get delayed. And the more you delay, the more delay is in the recovery. And it is more difficult to actually get you out of it. So, very importantly, like I was talking about this before, pain and other things that you experience are just symptoms. The symptoms get better in a shorter span of time. But what goes on is a cycle, a vicious cycle of pain, muscle weakness, and injury. You deal with the pain, but the muscle weakness still lingers, and you don't deal with that, it will again cause that injury and cause that pain, and the cycle goes on repeating. So do not delay to start the treatment as recovered, as recommended. And once you start, do not stop halfway. Even if your pain has gotten better, try to complete the rehabilitation protocol that has been suggested to prevent any recurrences or injuries and experience long term benefits from your pain. Once we stop talking about all the scientific and technical terms, you would like to understand like how to see or like how to approach the therapist. Now there are various ways in which physiotherapy, massage therapy, and other health professionals or services are covered for you. A lot of us who do not have any insurances except the OHIP are can also be covered under OHIP, but again, you have to talk and call them to see if you qualify for that, because like the rules keep on changing and we don't know. OHIP definitely provides a lot of free sessions too, but again, you have to visit an OHIP clinic for that, and there are very few in the city. Also, OHIP treatments mostly require doctors' referrals and are recommended only for certain conditions and certain populations. So, a lot of us, apart from the OHIP, would also be having certain medical benefits that are known as affordable healthcare insurances or extended healthcare insurance plans. A lot of insurance companies in Canada, like for example Sun Life, Manulife, and so on, they provide you with these extended benefits. Those can be provided to you by your employer if you are still working, or if you're not employed or working at any workplace, you can still buy them out of your own pocket. And obviously that takes care of a lot of things, like a lot of us might be visiting our dentists and opticians, like the optometrist, for your vision and glasses. Everything gets covered in those extended healthcare coverages. And lastly, for people who do not have any of these, they choose to pay out of pocket for those services. And definitely, like as health professionals, we help them a lot to have better prices and to feel better with the affordability, so that they don't miss out on their chance to the recovery. Next, it is important to know, like a lot of you might have, or maybe in the process of buying, or if not, I would still recommend that you talk to your financial advisor or anyone that you know in the field, so that like it takes care of you and you do not have to worry about, okay, you don't have to wait till you get injured. You know that you have, sometimes it just happens that we think, okay, why, like nothing has happened to me till now, then why? But you cannot, life is very unpredictable, and you don't want to wait till you have an injury. So here is a list of the major insurance companies that we have across Canada. Like I was saying, Manulife, Sun Life, Canada Life, even some banks like RBC and BMO provide private and customized plans to the employers. And the list is non-exhaustive, so this is just a simple list, but the list goes on, and there are a lot of it more. A lot of it covers other conditions or critical illnesses and other things as well. You can always like get to know more about it from your financial advisor. This is something that gets covered or is called an extended healthcare coverage through your workplace, or like I said, you can buy them personally out of pocket. But still, when you take a service like physiotherapy or massage, that would be covered under these extended healthcare services. Sometimes there are injuries that happen at the workplace for which you report it at your workplace and the workplace takes care of it through the workplace injuries called the WSIB or the Workplace Safety and Injury Board. Sometimes patients, like even in the senior age group, still working and sometimes with physically demanding jobs, there are more chances of injuries and they don't know what to do and they start paying out of pocket. And I know it's very expensive here in Canada, like I would also think if I have to pay out of pocket, but these things get covered under the WSIB. So just for knowledge purpose, it's important so that you or anyone that you know can benefit out of it. Another thing is motor vehicle accidents. They also are tied up with a lot of insurance companies. So, God forbid, knock on wood, like I hope not. But if somebody has to undergo that traumatic event, then your motor vehicle accident or those accident benefits cover you for physiotherapy and massage therapy. And lastly, nowadays, because Canada is experiencing a lot of refugees from different countries, so there are also interim health federal programs like called the IFHPs that cover for most of these services. So basically, when you have these insurance companies like helping you, then why do you need to pay out of pocket? Like you can see, there is a non-exhaustive list of how the insurance can be beneficial to you, not just for services like physiotherapy and massage therapy, like I previously mentioned, chiropractic services, osteopathic specialists like acupuncturists, naturopath, chiropodist, or the foot specialist, pelvic floor specialists, even shockwave therapies and other very expensive treatments also get covered under these insurances. So basically, you technically do not have to pay anything out of pocket. Again, going forward in the next few slides, I'll be talking more about how these insurers can be helpful for you. Also, very importantly, through experience, I've had a lot of patients, in particularly the seniors or even kids who are not able to visit us in the clinic. For them, in-home physiotherapy services are also provided, and these also get covered under the insurance plans. So once you know that, like, you can be stress free. There are a lot of medically indicated products too, like for example, you have a knee pain or an arthritis and the doctor has advised you for a knee brace, or maybe the same for a back pain, so a back brace. Sometimes patients have varicose veins and so many other things for which compression stockings, socks are also indicated. Foot conditions and pain can also be corrected using custom orthotics, or what we called inserts or insoles, and orthopedic shoes and other even portable TENS machines also get covered under those insurance plans. Some of the medical supplies that may or mostly may not be covered but still useful for you are those biofreeze gels, hot and cold packs, therabands or exercise equipments like balls, tapes, even postural braces to correct your posture, to make you sit straight. So maybe an ergonomic chair, a backrest, or even when you're driving the car seat, the cervical pillows, back supports, all of them can or cannot be covered under the medical health benefits. So you might have to talk to your insurance provider, or maybe wherever you go, you can ask them to help you out with that. Like I was talking about in the previous few slides, it's very important to understand, like, whether you need to go and see a physiotherapist first or whether you need to go and see your doctor first. So, in Canada, good news, you do not need a doctor's note to see a physiotherapist. It is something what we called a direct referral, where you do not need a note or a referral saying that you need to take physiotherapy. Even in India, it's not like that, but usually what happens, as physicians, because they are experts in their own field, so usually they become the primary point of contact, but it's a direct referral here. So most of the times, like, you do not need a doctor's note for a physiotherapy or a massage. But again, depending upon your insurance plans, there might be certain populations or conditions which might require a note. There might also be certain health professionals to whom, if you want to go and seek consultation, you might require a doctor's note. And also for the previously indicated medical products like stockings, braces, and orthotics or shoes, you would definitely require a doctor's note because those are medically indicated. So any like if any time like you have any doubt, it is always best to check with your insurance company like what or what not you're covered for. So this information that I'm going to highlight upon now is very important. First of all, you need to check if you are covered, if you have an insurance plan or not, and if you have, are you covered for those services? Next, if you need a doctor's note or not for the service that you're looking for. And also, it's important to know who else is covered. Like, apart from you, maybe your spouse, dependents like children or kids, or even parents sometimes can be covered under that plan. So, you might want to know. Also, it's important to know what is the maximum amount of coverage or the total amount that you're covered. If there are any deductibles or co-payments, like are you covered 100% or partially covered, which in that case you might have to pay that co-payment out of pocket. But still, most of them they cover like up to 100%, 90%, 80%, the remaining amount of which you might need to pay out of pocket. Also, you need to understand like how much the cost of your first session would be versus the follow-up session. So initial assessments, which include both the assessment and the initial treatments, might be a higher amount, and you might want to check how much your insurance is paying for that. Also, some patients, because it's important to understand what is the duration of the coverage. Is it like a calendar year from January to December or a rolling year? Like your insurance is starting from February and it's ending in Jan. So it's like a rolling year, or from August to July. The reason why I am stressing upon this point is a lot of us sometimes have insurances which we never use. And sometimes even, like we have injuries and we still like, think about, no, what if I run out of that coverage? So it's important to talk to the specialist, talk to your physiotherapist or massage therapist about this and understand how this insurance works and then make an informed decision. But that's a good news that most of the clinics and most of the therapists, they help you with this process of claim submission. So you can check if the clinic that you're going to provides direct billing or you will have to submit it manually. All you need to do is just find a good therapist or a good clinic nearby and take the first step. Most of them like most of the patients we help, like the clinic management will help finding out the coverage for you, so you don't have to take that stress of calling the insurance company. Nowadays we have apps. Also, submission of claims is usually directly done through the clinics, and they will provide you with all the copies of your invoices and other records that you can use for future even tax benefits. So it's important because money again is like important, but you don't want to waste the money. At the same time, that money will get wasted if you don't use it anyway. After talking about this very important things about how you can make use of your coverages if you have, and even if you don't have, how you can avail those services, something that I would like to talk about now is moving ahead with the last part of the presentation today is about what basically causes those pains and how to manage those pains and prevent injuries and any fall prevention strategies, or for a long term benefit how physiotherapy can be of help to you. So as you can see, most of us we always like focus on the problem, and the problem is the pain, but you need to understand what the root cause of the pain is. Lot of times we keep focusing on the symptoms like I said before, and we do not focus on the actual cause of the pain. And when you go and seek help from a specialist like a physiotherapist, then you realize, okay, maybe this was the actual reason that caused pain. So sometimes seniors don't even realize how they got injured, when they got injured, or why they are having the pain. And most of the common causes include posture, poor postures, muscle imbalances that can lead to weakness and tightness. So, a very good example here that I have highlighted is how a poor posture, like for example, in the neck, sitting or texting a lot or following a lot of gadgets can cause muscle imbalances on a longer run and therefore cause pain and headaches. Sometimes the weakness is in the core muscles that are deep within surrounding your spine. And over a period of time, that is what causes pain in the low back. Sometimes the weakness is in the hips, and that is what actually leads going forward to a knee pain or a foot pain, and therefore balance issues. Sometimes the problem is tightness in certain muscles that can cause instabilities, like, for example, a tight calf can cause pain in the ankle, and therefore that instability in the long run can make you more prone to falls. So understanding this is very important, because when you understand this, then you know like what exactly you are doing and why the treatment. So when we talk about those problems or the root cause of those problems, so simply correcting them through exercises or a structured plan can help prevent so many common injuries, and on a longer run like help to manage those chronic pains. By following these small habits and making these small changes in your daily routines, many of you can prevent simple pains and injuries and recover faster from them if you have one. So exercises that are directed to correct your posture, just making maybe making it a habit to sit straight and have a better sitting or standing posture or a walking posture, or even safe lifting techniques will help prevent a lot of simple things like, oh, I pulled my muscle here, I don't know what happened, I was gardening. Now the gardening season is coming, definitely spring has already started, so many of us like enjoy gardening, doesn't matter what age you are in. We never know when the snow would come next, so what happens when you do a heavy shoveling activity? So just managing these day-to-day activities, simple things like, getting up from a chair after watching a movie, or from a dining table chair, or even from your toilet seat, the ways and techniques like how to do that can help you better function and minimize those pains. So these tips and strategies ensuring safety in daily movements can improve comfort, improve your abilities like walking, like sitting and standing for a longer time, and therefore overall independence. It's very important to know what exercises you need. Sometimes it is not just about stretching. Oh, I stretched and I felt better. But what or how are you addressing the muscles which have already gotten weakened over time? So you need to understand all these things so that you can have like enhance your well-being. And the very last and interesting topic that I would like to highlight upon is about falls. Unfortunately, as we grow older, the body, the joints, the receptors in those joints react in such a way that we become more prone to falls. And sometimes it is not just neurological. It's not just, like you had a blackout or you had some other issues, you felt dizzy, your blood pressure got lowered, and you fell down. Sometimes it is about other conditions or weaknesses, or even like muscle imbalances that can actually lead to falls. So if we know the common causes of the falls, we know how to manage those falls and maybe minimize or even prevent those falls. Balance issues and to identify what is causing those issues, whether it is musculoskeletal, like whether it's your muscles, bones, or joints, or whether it is neurological. If it is neurological, the approach of physiotherapy or the approach of your physician will totally differ. If it is musculoskeletal, that is when physiotherapy mostly comes into play. Muscle imbalances. If the muscles are tight or weak, then addressing that through proper stretching and strengthening exercises can also prevent the risk of falls. Now, sometimes the fall is because the joints are not oriented properly, maybe because of arthritis, which is very common. So, wearing something that helps track those joints in place, like braces, splints, or even sometimes temporary taping techniques, can help guide the joints in place and therefore make sure that when you're walking, or even a sit to stand or stand to sit activity, can help make you feel better, not just with the pain, but also in the longer run, help prevent falls. Particularly, falls are very common in the bathrooms. So sometimes it is just not the water on the floor, but it can also be the way you move your body. A very common thing which we might not go in detail in today's session, but like it's diabetes. Diabetes is something that is one of a very common causes for falls. So when you're having diabetes, like if you're having or borderline or even like a medically diagnosed diabetes, it's important to manage that medically through your physician. And also lifestyle changes and exercises are very important. Diabetes can cause sensory and circulatory issues by affecting those small nerves and vessels, blood vessels in your body, which can actually cause falls indirectly. So what happens when you lose those sensations? Sometimes the way you walk, the way the ground forces or the body reacts to your walking speed and technique can actually cause imbalances and can lead to falls. So medically managing those conditions and seeking help through structured exercises can also help a lot. Sensory techniques like desensitization and use of compression stockings, education, awareness, and a proper foot care is important in such conditions. Moving on, sometimes none of us, a lot of us might not be having any issues at all, but it is just the wrong footwear or a wrong environment that can lead to falls. So making corrections or modifications with your footwear. So if you know, if you're having a chronic pain or arthritis in the foot or the knee or even the low back or hip, wearing orthotics or orthopedic shoes can actually not only manage those conditions, but in the long run it is like indicated to prevent the falls. You might not fall right away, but even tripping and twisting your leg in a wrong manner can lead to falls, and thus preventing those injuries is very important. And lastly, safety. Now if your environment is clean and clear of small or big clutters, safety is very important. You don't want to fall just because you didn't see a wire hanging, or maybe the carpet was torn, or maybe you tripped wearing a wrong footwear. So always ensure proper lighting in all the floors, particularly when waking up in the night for a sip of water, maybe going to the kitchen or even going to the bathroom. So a lot of patients have had these issues in the past, and like you don't want to be any of them. Ensuring your flooring and carpets are clear, they are taped, they are non slippery, there are no loose connections or cables or wires around is very important. The same thing applies for the bathrooms as well. So ensuring there are proper handrails or grab bars in case you have had this issue before. And mostly and last importantly, staircase. Going up or down the stairs, make sure like you keep yourself supported, doesn't matter to what age you are in. Using a mobile phone when you are going up or down the stairs or even in the bathroom can actually distract us, and therefore like one of the leading causes of falls nowadays. So make sure like you follow all these tips and strategies so that like you are free from any injuries and have a better life, pain free life basically. And lastly, so after talking about so much, and just listening won't do. So it is important that every one of us, like in our day-to-day life, just spend maybe 10 or 15 minutes of our daily life, and definitely like gives ourselves time. When you give that 10 to 15 minutes, do some small physiotherapy routines or exercises, simple things like range of motion exercises, gentle strengthening using gentle weights, and some balance and endurance training in the form of walking, or even if you like jogging, swimming, cycling, anything that helps make you feel better. It would definitely help you go in the long run, help you live a pain free and more independent life. A lot of exercises can be done just sitting on the chair watching TV, or even when you're listening to music, or you can just spend some time for yourself. So joint mobility exercises, structured strengthening for the whole body, some stretching on a daily basis, some breathing exercises that might you can include it through meditation or yoga, and some balance training. You did not balance as shown in the figure like the lady, but you can still make use of the wall or some chairs to stand on one leg, and or stand on both the legs if you have any issue. Just maybe try spending some time, and if needed, like visit a physiotherapist or a massage therapist, not just because you're having a condition, but if you want to, if you know that you might be predisposed to any of these conditions and you want to just know how to fix them or how to take care of it in the long run. So these gentle structured exercises, like even if you visit them for a session or two and get to understand what is wrong with your body, then you might be able to move forward with a more independent and pain-free and enhanced life. So thank you everyone, and I would really like to thank everyone who stayed, and everyone who took time to listen to the presentation. I know sometimes 1 hour is not enough. There are so many things which as a health professional I want to share or I can share, but of course we have to respect the time, and that is why we are here. Like the clinics are there where you can seek one-on-one consultation. So I would also like to appreciate the patients for your listening, and I would like to appreciate, sincerely thank Vaidehi ma'am and Mani ma'am for giving me this opportunity, and I really enjoyed. Let's see how much you enjoyed, and that's it for today.
Yeah.
And I think next we can move on to the question and answer session for a few minutes, and I can address any of the concerns, or if any of you have any questions that I can address to in the session today. I would request the questions stick to today's presentation, because I might not be able to assess or provide consultation.
Yeah,
Thank you. Thank
perfect.
you,
Yeah.
everyone. Yeah.
Thank you, Kritika. This is very informative session, and I'm sure all of us here got a very good insight on educating ourselves as to what kind of physiotherapy and what we can think of. And as you said, it's never too late, and don't wait until it gets worse. But taking prevention is better than cure is the mantra that I think we all should follow. With that, I think, yes, if anybody has questions, like now we have hands raised here. So, Anamika ji, if you want to unmute yourself and bring up your question.
Hello. Can you hear me?
Yeah.
Yes,
Hello, ma'am.
yes, we
Namaste.
can hear
Yeah.
you. Yeah.
Namaste. Namaste, Kritika. Thank you for your information. I'm really blessed. I just
Thank
wanted to know, which is more beneficial according to you, either physiotherapy or massage therapy?
Yes. So, like I had mentioned before, you have to understand what is troubling you. If it
Yes.
is a pain and the pain has been there for a very long time, or the pain is there after an acute injury, like you fell down or you hurt yourself. So, it is important to recover from that pain, and that recovery is scientific. So, when you need the help with that recovery, so more scientific approach to actually make that inflammation or healing process better is important. That can be achieved at first through physiotherapy. Now, if there is something that is chronic pain that you have been suffering from a long time, and it comes and goes, and it's more of an achy pain, like muscle pull, muscle aches, and it hasn't been troubling to that extent, like the intensity of pain is less, you can always go and seek massage therapy. But again, what happens is, like massage therapy, both of them, they work hand in hand, and you need to be consistent with whatever you are taking. So it's
Okay.
always advisable to seek consultation, get yourself assessed first, so the
Yeah.
therapist might be able to understand your condition and guide you in a better way.
Okay. Thank you
So
so much. Yeah, I have a knee pain. That's why I'm going to physiotherapist. Yeah.
yes,
Okay.
thank you.
Thank you so much.
No
Thank you.
problem. Yeah.
Thank you, Anamika ji, for your question. And there is one question by Mr. D'Souza in the chat here. How
Yes.
does neurological conditions physiotherapy helps in case of brain concussions due to traffic accident?
Yes, so definitely, as therapists, we come across a lot of motor vehicle accident cases in which there has been a traumatic brain injury, and sometimes it is the severity can differ. So concussion is a less severe version of like a severe traumatic injury, but still it can have long-term implications. So what happens is, like concussion is a syndrome. It's like a group of conditions, group of symptoms, and a lot of this it's like more medically managed. But what happens is, like as physiotherapists, there are a lot of things where we can help the patient with concussion heal in a better way. Now concussion happens when there is like this, like a sudden trauma to the brain inside the skull. So you cannot help the brain treat. So as a physiotherapist or even as a physician, you cannot go and fix that. But what happens, you can create that environment. So lot of times after the accident here, the muscles, they become very tight, they go into spasms and they get weak. So as a therapist, we help create that environment through structured programs and exercises, and help the patient get better with the symptoms likewise. Also, sometimes there are implications like you have dizziness, vertigos, and headaches, or even migraines because of that. And if it is through assessment found out that it is more musculoskeletal and also neurological, these symptoms, then it can be fixed with physiotherapy. But again, if you are experiencing issues like mood swings, if you're having sleep disturbances, or if you're having other psychological issues because of the concussion, then as a physiotherapist, if I come across any of those flags or symptoms, then I refer to the other discipline, like maybe a psychotherapist or the physician, so that they can have a better diagnosis and treatment based on those lines. Yeah, so maybe like, did I like, hopefully I answered the question.
Yeah, thanks.
Yeah.
Thank you for the answer. Are there any other questions? Anybody else has a question here?
Galban D'Souza has a question. Anamika has a question.
Yeah, Mr. D'Souza is already taken, and Miss Anamika is also done. Anybody else? Anamika ji, do you have another question?
I'm okay, thank you.
Oh, okay, yeah.
If not, then I had a question, like you already mentioned that the massage therapy and physiotherapy is already covered under OHIP. But then you said we should call and find out if we qualify or not, because most of
Sajji,
the
can you
schools...
speak a little louder, or maybe increase your volume a little?
Oh, hold on. Yeah. As you mentioned that physiotherapy and massage therapy is covered under OHIP, but then we should call and find out if we are covered or not. Do you know if it is as per what your income is, or your savings are, or what is the
criteria?
Yeah.
Okay. So firstly, if I had mentioned about massage therapy, that I might just like to correct that. Massage therapy might not be covered under OHIP. It's physiotherapy that is usually covered. And mostly what happens, if you are having a long-term condition or a chronic condition, or even sometimes like post surgeries where you require long-term rehabilitation, or sometimes even after like sir mentioned about concussions, or like some conditions, neurological conditions, that might again require many sessions. So the government also understands it's important to understand the affordability of the patient. So at that moment, through your hospital or through your benefits, you can be eligible for those OHIP visits. But again, what happens, not every patient, just because like if someone is in the senior age group, not every patient might be entitled for that. It's a long process. You might have to go and see your physician and get a doctor's referral, see the eligibility. So usually it is not based on the income or the savings, it is based on the condition or the population. So mostly the OHIP covers for such conditions mainly for very small kids, like I was talking about pediatric conditions, or very senior populations. So there are few OHIP clinics, like not every clinic will be dealing with that. So that is something where, because most of the cities, like per city there might be a couple, and Brampton is a big city, like very populated, so it might have more. But most of the other areas, they have very few clinics that deal with OHIP patients. So they would require a doctor's referral and become eligible to entitle those services. And mostly it is physiotherapy or rehabilitative services that get covered under that. But most of the other times, like then the patient has to pay out of pocket, because people don't. And also what happens, OHIP is like government service, right? Like, so you might have to wait for a long time to actually go through this process. And also people are in a lot of pain. You cannot wait for 6 months to get an appointment with a physiotherapist. Already things, the medical system is a bit different here. So that's why sometimes people rather refer to pay out of pocket. And Usually because they're paying out of pocket, so the costing in every clinic would be different if you have benefits or not. So like that the OHIP works. But again, you might have to actually find out an OHIP clinic close to your place and ask them how they work or what requirements are there. But it's definitely not based on your income or any savings.
Thank you. Thank you.
Yeah.
Now, it's a good suggestion that you said seniors should not fall, because the fall is the biggest problem for seniors.
Yeah. Sometimes, they say, okay, she's old, that's why she felt. Everybody falls, like even kids fall, middle-aged people falls, everybody can fall. But the fall, if we know that something can be prevented or corrected using simple habits or techniques, then sometimes it's just small things that we fail to address and we fall down. So, and when you fall down at a particular age, the rehabilitation, the body's mechanism totally changes. So that is why prevention of falls is very important to be discussed.
Especially the seniors, if they fall, it takes long time to
Long time.
recover.
Long
Yes.
time to heal, correct? Yes.
Yeah, I do
Right.
have a suggestion for that. I have a iPhone watch. If even if you don't fall, if you jerk like that, it gives you, oh, did you fall?
Oh,
Yeah.
okay.
So it's
Yes.
very important to have this watch for the seniors. So if they fall, if they are alone, because most of the seniors either they are alone, or they are widow,
Yeah.
whatever, divorced.
Living alone,
But
yeah, that's true.
yeah, but this watch actually helps a lot. So
True.
Right.
in that case, even if you cannot call 911, this calls you
It calls
911.
911 too. Yes, yes, I've
Right.
heard about a story
Right.
like that. Yeah,
Yeah,
that
yeah,
the watch call.
Yeah. Now, technology is very advanced. There are like a lot of things, equipments that you can place in the home too, like around your bedside, like even on your body, like any way, so that actually sensors or directly calls are made to the emergency services. Even sometimes like pets, uh, therapy dogs or therapy pets are
Service
also there. A
dog.
lot of
Mhm.
seniors, they actually have them at home, particularly if they're living alone. So there are so many things. Yeah.
yeah, yeah.
Yeah.
True, true. Great. Anybody else? Any question? Any other questions? If not, then yes, I would like to take this opportunity to thank Kritika for her
Thank
valuable time and to share her important insight, which I'm sure it has been very beneficial. And I wish that we have some takeaways from this presentation, and that must have helped all of us to actually take caution for our health and well-being in future. And with that, of course, we plan to have this presentation, this recording will be shared also. So don't have to worry about that. So you'll get to see the presentation again. Yes, Mr. D'Souza.
How can we connect with Kritika, Ravi, in case of any consultations required?
you.
Yeah. So how would you like to, Kritika, are you okay to share email? Do you want to go through us? Like, kind of, yeah.
Um,
Um,
yeah, I would rather what I suggest is because there might be more people who might access. So it is always not that I don't want to help. I definitely want to help. But what I can do is, since I'm representing Panorama India and BMG today, so maybe if it can go through them, and I can provide the email address to them, and if somebody personally requires, or if they would like to discuss only with the therapist, some have a private discussion or consultation about that, then we can go ahead and then they can provide my email address to them.
Absolutely. So basically, Kritika would also be associated with clinics, right? So apparently, this is a profession. So what we can do is like, and if you're interested in going for consultation or something like that, then she would later provide details of the clinics that she associates with at later stage. Then you can reach out with those clinics. So at least then you know that who's, and then you can actually request for Kritika as your physiotherapist from those clinics. Does that make sense, Kritika? Would that,
Yeah, definitely. I would love to go forward and help anyone,
yeah,
not just who is at present here today with us, maybe, but anyone they can refer. Like usually, it does happen.
Yeah. So in the meantime, if you have any questions, feel free to share them in the group as well and drop us, and we can have them forwarded,
Right.
and we can see if Kritika is. I mean, we don't want to burden her with questions. Like, I'm sure she has a job to do as well. So, but yeah, I'm sure she's happy to answer whatever she can. Right? Like, yeah,
Definitely. Yeah.
yeah. Sure. So thank you very much, Kritika, and thank you very much, ladies and gentlemen. Thank you for attending this session. The primary objective of the conducting such sessions is to help our seniors gain some insight and for their health and well-being. So this is one of the reasons that we actually encourage all of our seniors to attend these sessions. So, and you took the time. I want to take this moment to thank all of you. Stay well, stay happy, and in good health. Thank you, Kritika.
Thank you
Thanks
so
to you
much.
as
Yeah.
well.
Good night, everyone. Yeah. Thank you. Thank you so much.
Good night. Thank you.